Good evening. I'm psychiatrist Jay Falver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 37th year, Matters of the Mind is a live call-in program where you have the chance to choose a topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720. Or if you're calling outside the Fort Wayne area, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live from our fantastic PBS Fort Wayne studios that lie in the shadows of the Purdue Fort Wayne campus every Monday night. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with an email I received this week. It reads, Dear Dr. Falver, my 15-year-old adopted granddaughter has always dealt with anger issues. Now, as a freshman, she is failing her classes. She has explosive outbursts and threatens her parents when they try to talk to her. Her birth mother was a drug user. Could a support group help? The support group could help perhaps you as adoptive parents, but also her. And the whole idea of a support group will be based on the need for that particular community. In other words, a therapy group will identify that they have several people within their practice who have similar problems. And on that basis, they'll get a support group together. Now, one of the best support groups ever created in the history of mankind was Alcoholics Anonymous back in the 1930s. It's still going strong. Alcoholics Anonymous did it right because they identified a need with a large group of people. They started with a core group of people, and then as they progressed through the program, they call them steps in Alcoholics Anonymous, some of them became mentors. And they mentored people who are newer to the group, and it continues to be one of the best means of alcohol rehabilitation we have. Now, we have some really cool medications nowadays that help people decrease their craving for alcohol use, but quite frankly, that supportive environment can be very helpful. So in your case, a support group for an individual who was conceived and developed in the womb under the influence of drugs of abuse by the mother. Yeah, you could identify perhaps other parents who had similar difficulties, but quite frankly, that particular child who's been in that situation sometimes can do well in groups themselves. Now, adolescents, well, you have to be careful. You have to be very controlling over that group and make sure it doesn't get out of hand, because adolescents sometimes will model bad behaviors from others. So you have to be aware of that in group therapies. But with a group therapy or a support group in general, yeah, you have to find a group of people who have similar interests and maybe a therapist or a practice that deals with those kind of problems. But if you can develop your own support group just by networking among family and friends, that can be very, very helpful for somebody like that. NAMI, which is National Alliance on Mental Illness, has been formed over the past several decades. NAMI basically is a group of parents and family members, and now some people who have mental health disturbances, that they gather together to try to support each other to help them deal with their loved ones who are going through severe emotional problems and help them kind of navigate how to get the best treatment. Thanks for your email. Let's go to our first caller. Hello, Janet. Welcome to Matters of the Mind. Jenny, you want to know what it means to have a chemical imbalance. That chemical imbalance is kind of an old term used just to say that, okay, you have a condition that would possibly benefit from psychiatric medications. Now, what's the difference between, getting counseling and getting psychiatric medication? Well, quite frankly, if you use an analogy of an automobile, all right? You've got a couple chemicals, one called glutamate and one called GABA. Glutamate's like the accelerator, and GABA's like the brakes. Glutamate and GABA sit out here in the gray matter of the brain, the outside part of the brain, the thinking part of the brain, the emotional part of the brain, the impulse control part of the brain. Glutamate and GABA are in that fine balance. So glutamate's the accelerator, GABA's the brakes, and that's about 95% of how this gray matter works. Now, down deep inside the brain, in the so-called brain stem area, right down here, you're going to have squirting up to the gray matter, giving advice, serotonin, norepinephrine, and dopamine. Then you have this other receptor that gets stimulated called sigma-1 receptors. And sigma-1 receptors will modulate how serotonin, norepinephrine, dopamine, and glutamate are all being used. So here's the bottom line. If you think about the accelerator for glutamate and GABA for the brakes are in fine balance, serotonin, norepinephrine, and dopamine are kind of in the passenger seat giving advice, all right? Serotonin is kind of telling you to calm down, slow down a little bit, whereas norepinephrine and dopamine are telling you to speed up and get more motivated, get more energy. Then you got in the back seat, got the back seat driver back there. That'd be the sigma-1 receptor, because the sigma-1 receptor is then trying to modulate how much activity the serotonin, norepinephrine, dopamine, as well as the glutamate are being used in the course of the travels. Now, where does psychotherapy play into all this? Psychotherapy is more like the GPS. You don't probably use GPS everywhere you go, but sometimes you really need it. If you're driving through Chicago, for instance, you really need GPS typically. Some people don't, most people do. And it's the same with psychotherapy. Some people have the skills to be able to navigate through life's challenges. They don't need their GPS of the counseling or psychotherapy to get through their life challenges. Other people do, because they're having trouble navigating through coping strategies. They're having difficulty with past life experiences that certainly influence how they're feeling now. So in those cases, it can be helpful to have that psychotherapy GPS. So with a chemical imbalance, that's inferring that somebody could benefit from a psychiatric medication for their current symptoms, whereas with GPS, it means, okay, they just need some guidance and maybe some awareness and insight into the kind of difficulties they're having to make the best decisions. Thanks for your call. Let's go to our next caller. Hello, Ann. Welcome to Matters of Mind.
Daughter. She's 58 years old, and she's fearful of strangers, mood disorder, anger, and totally obsessed about living with mom and dad again, and almost constantly talking to herself about living with us again. She's on Trintellix 10 milligrams, gabapentin 100 milligrams BID, lithium 150 BID, Seroquel 50 at night. I feel she needs meds for obsessive thoughts. That tends to have been a pattern for her for years, and nothing cognitive works for her. But I am fearful of, TD. So far, she hasn't shown any signs of that.
Well, let me interpret some of the very good points you're making there, Ann, for our other viewers. You'd mentioned obsessive thoughts. Those are thoughts that don't make a lot of sense, but she's ruminating and dwelling on them unnecessarily. Now, if you worry about things in the future and you're brooding about things that might happen in the future and you have a lot of doubts about the future, that can be what's called generalized anxiety, a whole different phenomenon. Obsessive thoughts would be where you have thoughts that don't make any sense, but you kept going over and over them, and you get anxious if you quit trying to think about them. So obsessive compulsive disorder can include obsessive thoughts, where you have these thoughts that don't make any sense at all, but you can't get them off your mind. And many times people will convert these thoughts into behaviors, which are called compulsions. Compulsions would be such behaviors as checking and rechecking, counting compulsively over and over and over again. Compulsions can include obsessively cleaning and feeling like things just aren't clean enough. So you've got the obsessions going on there. You're concerned about TD, that's tardive dyskinesia. Tardive dyskinesia is indeed a phenomenon that can occur for people who have non-psychotic conditions, such as a mood disorder or an anxiety condition, and they're using a so-called antipsychotic medication. You had mentioned she's on Seroquel, also known as quetiapine, 50 milligrams at bedtime. That's a very, very small dosage. At that kind of dosage, you're primarily getting some effects on serotonin and histamine. So you're not getting a lot of dopamine blockade. The dopamine blockade over the course of time for somebody, especially with a mood condition, can potentially cause an increased budding of more dopamine receptors. So it's kind of like blocking something, and then you have, as a reaction to something getting blocked, more growth of something else in the same category. So tardive dyskinesia basically is where you're budding out too many dopamine receptors, gives you twitches and tics, and that's seen for people who are on strong, potent dopamine receptor blockers, of which Seroquel is not one. So Seroquel, we now have Caplyta, which has very minimal dopamine receptor blockade. We have a lot of other medications, Safras, asenapine being another one. They don't have as much dopamine blockade as the old medications did, such as haloperidol. Risperidone is a strong dopamine blocker. Ziprasidone is a strong dopamine blocker. Now, how do you deal with the obsessive thoughts? Yeah, Seroquel, quetiapine can be an option. Trintellix, you mentioned, that's also known as vortioxetine, 10 milligrams. Kind of Medium dosage, about 3 out of 5 people on Trintellix will take it at 10 milligrams, but at a higher dosage, perhaps 20 milligrams, it can sometimes relieve some of the obsessive thoughts. But from a medication standpoint, Ann, there are some changes that can be made. Lithium, 150 milligrams twice a day, that's a good dosage for a lot of people because it can improve impulse control. Lithium at a relatively low dosage, interestingly enough, is anti-suicidal. So for people who have these ruminative thoughts about taking their own lives, lithium at very low doses can be very helpful for those people. And of course, you mentioned gabapentin. 100 milligram doses are great. We'll use gabapentin nowadays as an alternative to Xanax, Klonopin, Valium, Ativan, those so-called benzodiazepine medications. Unfortunately, especially for somebody who has special needs, it can cause a inadvertent worsening of their impulse control. So if somebody who has developmental conditions if they take a benzodiazepine, which you'd think would calm them down, sometimes it makes them a lot worse. Gabapentin is an old anti-seizure medication approved back in the 1980s and has been around for a long time. Now used more for anxiety, for pain, and for sleep, and it can be used as needed for somebody who's having intermittent outbursts like that. There is a medication that sometimes can be helpful, and you might have heard of these already, Ann, but one medication is called guanfacine. Guanfacine's been used to help with distractibility and focus for attention deficit disorder as an add-on medication. It was originally approved as an antihypertensive, so it can bring down the blood pressure a little bit, but many people will notice that a little bit of guanfacine can be helpful. So it's a matter of figuring out, okay, how's the Trintellix doing? How's the gabapentin doing? How's the lithium doing? How's the Seroquel doing? Looking at all those and finding the ideal dosing and sorting out, okay, what's doing what, and trying to figure out, do I really need all 4 of them, or are all 4 of them at a low dosage doing okay? Now, it used to be thought, Ann, that, if you take 4 medications, that's a bad thing. Well, now we realize it's kind of like vegetable soup. If you have vegetable soup, you have a lot of things in there. That's really okay. And if you take a low dosage of several medications, it's actually safer sometimes than taking a high dosage of a medication like Seroquel by itself. So back in the 1970s, 1980s, when I was trained as a pharmacist, we were always trying to figure out how we could decrease the number of medications people were on, and that was a very noble type of an attempt, but we kind of find out that low doses of medications that have different mechanisms of action can actually be safer for a lot of people. And thanks for your call. Let's go to our next caller. Hello, Phil. Welcome to Matters of the Mind. Phil, you want to know, what is marijuana-induced psychosis? Marijuana tetrahydrocannabidiol is a chemical that can sometimes induce psychosis by accelerating dopamine in the brain and causing people who are particularly prone to losing touch with reality to get initially paranoid. I talked to a young man earlier today who noticed that every time he used marijuana, he got more paranoid. So he realized it probably wasn't the best thing for him. So some people are prone to getting more paranoid with marijuana. The potency of marijuana makes a big difference. Back in the 1970s, the potency of marijuana was quite minuscule. Now it's several times more potent because of the hybrids of the plants. So with a higher potency of tetrahydrocannabidiol, it's more likely to cause psychosis compared to the weaker strains in the past. So it's basically a condition where you'll all of a sudden get paranoid, you get agitated, you might even start hearing voices. You don't perceive the world around you as being as it is to other people. So you lose touch with reality. That's the whole concept of psychosis. Sometimes marijuana-induced psychosis can be permanent, especially if you have a family history of psychosis, especially if you have a family history of mood disturbances. But quite frankly, Phil, in the past 10 years, I've seen individuals develop marijuana-induced psychosis that tends to be permanent in some cases where they don't have the family histories. Now, back in the 1980s and 1990s when I was first practicing, typically if somebody had a marijuana-induced psychosis, I could usually identify a family member as they described them to me who might have had some of those kind of features of psychosis, and I could relate it to the family history. Now I'm seeing people who have no family history of schizophrenia, bipolar disorder, no psychoses at all, and I'm seeing people develop marijuana-induced psychosis that is long-lasting. So it's something we need to be very careful about, especially as many states are now recreationally legalizing the use of marijuana. For some people, that's sanctioned its use, and especially for younger people, people under 24 years of age, marijuana can be very, very dangerous for them, not only in suppressing their white matter development in the brain. I mean, the brain has this white matter, this insulation throughout it. It's called white matter. You suppress the white matter growth, and that will affect your ability to retain memories over the course of time, and it also appears to change the networking in such a way that it can cause you to lose touch with reality. So we have to be very, very careful with the use of marijuana, especially for anybody under 24 years of age. Why 24 years of age? Because it's up to that time that the front part of the brain especially is still growing. So as the front part of the brain is still growing, you don't want to do anything that's going to really disturb that. That includes marijuana. Alcohol use. I know alcohol is legal for individuals before the age of 24 years of age, but people need to be very, very careful with alcohol use during that time because the brain is still growing up until the age of 24. And quite frankly, that's why automobile insurance premiums are much higher until you get to be 24. So you start driving at 16, between 16 and 24 years of age. If you notice it, automobile insurance premiums are higher for that age group. After 24 years of age, automatically, most automobile insurances will go down if you've not had a lot of accidents previously. But they take into consideration that before the age of 24, your impulse control, your ability to concentrate is somewhat compromised compared to after 24 years of age. Thanks for your call. Let's go to our next caller. Hello, Shannon, and welcome to Matters of Mind. Shannon, you mentioned that your daughter recently began on birth control pills to manage her periods, and you're noticing a change in her mood, and she seems depressed. Is that a common side effect? Should you ask for a change? I absolutely, positively would talk to her clinician and talk about a little bit of a change. On one hand, Shannon, birth control pills, oral contraceptive medications can be dramatically effective for helping the mood because they stabilize the hormones of estrogen and progesterone, and in doing so can decrease the premenstrual symptoms, the PMS symptoms that some women will have anywhere between 3 days and 2 weeks before their periods, and then they have their periods and they feel fine. So if you stabilize the hormonal status of estrogen and progesterone throughout the month, that's less likely to be problematic for the premenstrual symptoms. Many young women will also use the oral contraceptive medications for the use of controlling acne. So there's a lot of benefits for that, but estrogen and progesterone are in different quantities in different formulations, and if the formulation your daughter is using is causing more depression, by all means, that's not considered to be normal, and that's not a normal side effect. That needs to be adjusted. Sometimes it could be adjusted with the current medication being used, and sometimes she needs to go to something else. So talk to her clinician. Depression with oral contraceptive medications is not a normal side effect. That can be adjusted. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Favre, I am on anxiety medications, but I still feel anxious throughout the day. What are some lifestyle changes that I can make to supplement my medication? Well, number one, I'd wonder what medications you're taking for anxiety, because some medications for anxiety, they get in your system, they get out, they get in, they get out. I talked to a woman earlier today who's on a pretty good amount of alprazolam or Xanax, and it's the first time I had seen her, so I was wondering how she feels throughout the day, and that's what's happening. It's kind of a roller coaster of mood swings. So we try to get people off of the so-called benzodiazepines, Xanax, Ativan, Klonopin, Valium. Klonopin and Valium last longer, but it's nice to get people off those medications because you can kind of get used to them, and as they wear off, you can feel exceptionally anxious. So the benzodiazepines, if you're taking those, it could be an on-off effect from those medications. If you're taking the so-called serotonin medications, serotonin medications are Lexapro, Prozac, Celexa, Zoloft, Paxil. These are medications that will all increase serotonin and give you somewhat of an emotional numbing effect. Now, emotional numbing effect, it's kind of tricky. You don't want too much of it, but you want enough of it so you can put up with things. So if you get the emotional numbing effect, that's all right. So what can you do to really help yourself naturally with anxiety? Being around people, doing things that normally would make you anxious, believe it or not, the more you do those kind of things, the less anxious you can become. So practicing social situations that might make you anxious will always typically help anxiety the more you do it. Exercising is something I can't emphasize enough for people. Exercise is a remarkable means of helping the mood, the concentration, and anxiety itself. So if you exercise, especially with anxiety, resistance training, weight training appears to be very, very good for anxiety, and weight training, especially for older adults, those of us over 55 or so, older adults really respond well to weight training, especially for sleep. So weight training can help with anxiety, can help with sleep. I don't typically recommend a lot of natural supplements for anxiety because I prefer people try to deal with things more naturally, as you mentioned, but a natural supplement would be theanine. Theanine, people use that. That's the natural ingredient in green tea, and sometimes that can be helpful for naturally helping with anxiety, but preferably I'd rather see people exercise and try to get enough sleep. And getting enough sleep will kind of reset your brain and recalibrate your ability to put up with things, because as you're sleeping, the reasoning center of the brain is able to rest. And if your reasoning center of your brain is able to rest at night, that's the left front part of your brain, it's called the dorsolateral prefrontal cortex. As that rests at night, you're able to think through and cope with things better the next day. What if you don't get enough sleep night by night by night? Well, that part of the brain's not resting so much, and you can't think through things as clearly. So it's kind of like recharging your battery when you are getting enough sleep. So sleep hygiene, where you're getting to bed the same time every night, you're trying to get up the same time every day, getting in that natural cycle of sleeping well is going to be very helpful for helping you with anxiety. Now, some people will notice they sometimes awaken in the middle of the night. That's okay every now and then. But about, 4 out of 7 nights in the week, 4 out of 7 nights of the week, if you're getting a good night's sleep, that's pretty good. If you don't get so much sleep one night, you might notice that you have a little bit of a sleep debt, and you're repaying that sleep debt the next night where you're sleeping more, and that's perfectly normal as well. Thanks for your call. Let's go to our next caller. Hello, Carlos. Welcome to Matters of the Mind. Carlos, you'd mentioned that you're studying with college-level exams. How can you train your brain to be a better test taker? To be a better test taker, you probably want to practice taking tests, Carlos. And a lot of booklets do have practice tests in them, and you want to take the tests that are similar to the actual tests that you'll eventually be taking for the college-level examinations. So, for instance, SATs. A lot of SAT booklets out there. They give you a lot of practice exams, and that's the best thing I would suggest. Whether it be examinations or any particular kind of anxiety-provoking situation, Carlos, the best thing you can do is to practice similar type of feats in trying to decrease the anxiety. So in your case, finding some practice tests to be able to take where they'd have a similar structure, similar type of answer responses. Some tests will have questions where they'll ask you, is it A, B, or C, or is it A and C? Is it none of the above? Is it all the above? You want to have those same kind of answers available to you when you're in the practice test. Thanks for your call. Let's go to our next caller. Hello, Tammy. Welcome to Matters of the Mind. Tammy, you want to know, is it possible for your brain not to store small details? Is that a thinking trait or disorder? It's actually advantageous, Tammy, if your brain does not store small details that aren't relevant, and it's called neuroplasticity. It's a remarkable phenomenon, Tammy, because each of our individual little neurons, especially in the hippocampus here, they have all these different branches on them. In the hippocampus, that's the memory storage part of the brain, they have 50,000 branches on each individual little neuron. And if you're trying to remember every single minute detail of your day, it'll just be overly fluffy, and there'll just be a hodgepodge of all these thoughts in your head. You don't want that. You want to be able to pay attention to things that you need to pay attention to. So our brains have this remarkable ability to prune off all the excessive neuron branching, just like pruning off a tree. So if you have a tree, it's got some dead limbs on it, you're not using those limbs, they're not doing much, just prune them off. Rose bushes are classic for this, because if you prune down your rose bushes, you'll actually get more roses. The neurons do the same thing. Your neurons will be able to naturally prune down some of the areas that are not useful and then build up. It's called synaptogenesis, but they build up the branching in areas that you really need. So your brain is naturally able to identify all of that type of process. So the pruning down is called apoptosis. The increased branching is called synaptogenesis. A healthy brain is able to naturally figure out what it's got to expand upon and what it doesn't focus on as much. But what if your brain's not healthy? Well, it means you're going to be holding on to details that aren't relevant, and it's thought that it's part of the process of obsessive compulsive disorder, where you're focusing on things that you really shouldn't focus upon. Thanks for your call. Let's go to our next caller. Hello, Brooke. Welcome to Matters of the Mind. Brooke, you'd mentioned you're on Zoloft, also known as sertraline. Found out you're pregnant. Should you stop your medication? Zoloft is also known as sertraline. It's a serotonin-based medication. It's been around since 1992. It's a medication, quite frankly, that in my practice we are using throughout pregnancy and during breastfeeding, Brooke. We can't say that about a lot of medications. Now you might think, well, gee, was it very well studied? You don't proactively study medications during pregnancy. You're not going to get a bunch of women to sign up who are pregnant saying, okay, I want to be studied with this medication to see if it's safe during pregnancy. So what you do is during pregnancy, you happen to find women who have been exposed to Zoloft and see how their babies did, not only in their early years, but in the adolescence. Zoloft is one of those medications that has been found throughout all 3 trimesters of pregnancy to be safe and not causing neurodevelopmental disorders, even when the baby grows up to be an adolescent. So sertraline or Zoloft, in my opinion, is something that can be used during pregnancy. Always talk it over with your obstetrician to see if that's a possibility. And of course, the pediatricians are really up on these things too. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org, and I'll see if I can answer that on the air. I'm psychiatrist Jay Fauvre, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.